Hello and good afternoon. Thank you for joining us this afternoon for our panel discussion on reverse mentorship. My name is Stuart Tuckwood. I'm the National Officer for Nursing at UNISON, and I'm going to be moderating this panel this afternoon. The topic that we're going to be discussing is reverse mentorship and what does the next generation want from work. And I'm really delighted that we've got 4 fantastic guests to join us for this topic this afternoon. We've got 2 junior nurses to give us their perspective on being newly qualified and to talk about what they want from the world of work in the NHS. We've got Yasmin Khanagha, who's a newly qualified nurse from Yorkshire Hospitals NHS Trust. And we've got Charlotte Jakab-Hall, who's a senior staff nurse and Chief Nurses Junior Fellow at Gloucestershire Hospitals NHS Foundation Trust. Hopefully her technology will work and you'll be able to see her at some point. And then from our senior nursing perspectives, we've got Kathryn Halford, who is the Deputy Chief Executive and Chief Nurse at Barking, Havering and Redbridge University Hospitals Trust, and Arlene Wellman, who's the Chief Nurse at Epsom and St Helier University Hospitals NHS Trust. So what we're going to do this afternoon is we're going to start by spending some time discussing support, training and development opportunities at work. We're going to go around each of our panelists who've each got 5 minutes to give some opening views and to share their experiences on this subject before we open up to taking some live questions from those who are watching at home. And I've got a number of questions that I'd love to put to our panelists if we have the time, but we will make sure we've got time for questions from the audience. Just to start with a couple of housekeeping rules. Obviously, for everyone at home who's watching, you won't be able to contribute during this initial part, but please get any questions that you want to ask over to the speakers via the chat function on Swapcard. And just to start with, I'm going to spend a couple of minutes talking about my own experiences for this discussion and bringing in some of the issues that us at UNISON would like to discuss and that we know that there are from our membership in this area. It wasn't really so long ago that I started my career as a registered nurse. I trained in Scotland at the University of Glasgow, but then moved to take up an opportunity at a major trauma centre in England. I started out my employment, I went for a position in a major trauma rehabilitation unit. But when I began working in that major trauma centre, initially that rehab unit that I'd applied for was actually shut, and I was immediately redeployed to work in an acute neurosurgical ward. I'd really wanted the opportunity to kind of bed in and give myself an opportunity to develop my skills and in an area like a rehabilitation unit, and found it really, really intimidating and difficult to actually start as a newly qualified nurse on an acute neurosurgical unit. I really vividly remember my first day thinking that it's great, everyone will understand, everyone will know that, you know, I'm new and I can't take too many patients. And then we realized we were 2 nurses short and I was actually going to have to take a whole bay by myself and 10 patients. I did manage to deal with it, obviously, and get through it, but it was, I think, looking back, really exemplified some of the pressures and some of the difficulties that our newly qualified nurses in the NHS face. After that, I promised to myself that when I'd started that I'd give myself at least 2 years in that first role as a Band 5 to really consolidate my skills and my knowledge and to manage that transition before I thought about any promotions or any career opportunities. But actually, I ended up moving sooner than that to work as a Band 6 on an acute neurosurgery and neurology unit. I really wanted to progress my career. I was quite ambitious and I wanted to do more in nursing, but I wasn't really sure, I think, at that point of the pathways and how I would go about developing my career. And actually, I found that transition from Band 5 to 6 to being in a charge nurse on an acute unit really, really challenging. I suddenly found that I had huge amounts of responsibility, not just for patients, but for staff that I was expected to manage, and for more junior nurses who were now turning to me for support and for their development. And I also found that I had less of that quality time and interactions with patients, which was something that I really valued in the role. So actually, I found that really difficult. And also, I think within the first month I started there, I was informed by the Band 7, who was going away for 2 or 3 weeks immediately after I started in that post, that myself and the other new Band 6 would have to manage the appraisals for the entire team in that next 2 or 3 weeks while she was away, which left us in a really difficult situation and was really a struggle for me. After that, I went on to work in a rapid response role, which was a job that came with a lot of autonomy and an opportunity for a more manageable workload and to develop my skills, and actually really enjoyed that role and really enjoyed that opportunity that I was given. But I think if I was to have stayed in that role as a Band 6, as a charge nurse, I think I would have really struggled to manage the workload and stay there. So that's just a couple of my reflections on my own personal experiences, but I'm going to talk for just a minute about the issue of line management, because I think that's a topic that is really interesting for this subject. UNISON ran a survey jointly together with the Nursing Times and Managers in Partnership a year or two ago, and discovered that actually a lot of line managers in the NHS really struggle with providing the space and the time to talk to their junior staff about career development and opportunities. And I think that's something that hopefully our more senior nurses can reflect on, how we support our line managers and how they give help to newly qualified nurses, and something maybe for us all to discuss. And I think before I hand over to Yasmin, I'm just going to obviously acknowledge that we're all going to be very aware of the challenges and the difficulties that we're facing at the moment in dealing with COVID-19. But obviously, we know that there was a lot of pressure on staff in the NHS even before COVID-19. We know now that we've got lots of staff struggling with burnout, with stress, with exhaustion. And I think it would be a really interesting time for us to discuss and think about how we even begin to talk about career opportunities and developing your career pathways at a time when staff are under so much pressure. And what are those challenges going to be and how are we going to overcome them? Okay, so I think that's enough from me. So I'd like to hand over to Yasmin Khanagha, who is going to tell us a little bit about her experiences as a newly qualified nurse and how she's found it. Over to you, Yasmin.
Thank you. So as Stuart mentioned, hi, I'm Yasmin and I'm a newly qualified nurse and I'm currently working at the Yorkshire Hospitals. So despite being just a newly qualified nurse, I have been involved in quite a few development opportunities, and one of the biggest ones is being in a preceptorship programme. So a preceptorship programme is when you are working with a preceptor for 12 months and you get to undertake lots of study days and you get to do a lot of competencies, and the whole idea is to help that transition from being a student nurse to a newly qualified nurse and to hopefully be a junior nurse. And I feel like it's really important to talk about a preceptorship programme. It's often overlooked. It's really good for retention, and especially for me, it's really eased that process, especially those first few weeks when you're off the supernumerary and you're really terrified. I remember being very terrified when I was officially in the numbers, but fortunately I was working with my preceptor on the day and she made that whole day a lot easier. So yeah, going through competencies, just reconsolidating my knowledge. We normally would go on study days, but unfortunately due to the current situation, those are being cancelled, but we'll definitely go on those during a later date. And quite a few of those are interesting. I'm really looking forward to reconsolidating my knowledge on diabetes and even learning a few new concepts such as orthopedics. So yeah, overall really happy that my trust is doing such an amazing job on the preceptorship. And then another thing I really wanted to talk about was being part of a BAME network. So as myself, I'm actually half Asian and half British, and I'm the only BAME person in the entire children's unit. So for me, that's quite a daunting aspect, being the only person of colour and working with being the only person really. So the BAME network was brilliant because it basically put a similar face for me, and it was really nice to speak to a lot of people from different multidisciplinary teams and how they're coping with the current situation, especially as a BAME individual. We're at a higher risk, so again it was really nice just to get to know other people who were identified as BAME. And finally, I really want to talk about being involved with the RCN. So as a newly qualified nurse, a lot of people, including myself initially, we thought that basically because we're newly qualified nurses, we can't really get involved in the RCN and being a leader, and that's completely the opposite. I'm really lucky in the sense that I've actually been involved in a forums committee, which is really cool, and I'm really looking forward to being a part of it, as well as being a branch team. As well as being involved in a branch, not as a committee, but just involved in a branch. And it's really nice because I was initially a student ambassador and I get to basically work up. So that's really cool. And then lastly, I want to talk about some of the other things that I'm thinking in terms of long term. So I'm really interested around research and academia. So hopefully I'll be able to look at those in the future. And yeah, that's me.
That's brilliant, Yasmin. Thanks for that. I'm obviously very jealous that we don't have you as a member of UNISON, but I'm glad to hear that you are getting engaged with your local trade union as well, which is brilliant to hear. And obviously that's good that it's not something that's just for more experienced staff, but obviously you can get involved as newly qualified as well. Can I ask you the BAME network that you talked about in your workplace, is that something that's organised through the staff, or is that something that the trust provides and really advertises to you as a newly qualified nurse?
So it's by the staff, and it's just something that's just been initiated. So it's called the Call to Action because it all sparked basically during the COVID well, it was meant to spark before the pandemic, but it started to initiate during the pandemic due to the high risk, and then obviously what the horrible incidents that happened around end of May, beginning of June. And we all felt it was really important at that time that there was a sense of safe community, especially for like BAME individuals. Myself, I've been very lucky in the sense that everyone in my team is very supportive. However, I'm not sure, there probably would have been a few cases where individuals are being discriminated, and it's a real shame. But yeah, the BAME network is the idea that there is a safe belonging and people feel welcome. Yes, it's run by staff.
That's great, yeah, and that sounds like that must be something that's made a real difference to you then. And I understand as well that you're studying for a qualification in ethics, I think you said to me, and I'm interested how you've managed to do that alongside being newly qualified and doing all the other things that you've talked about as well, and whether you feel you've been given enough space and support to do something like that.
So I feel like one reason why I decided to do a master's straight away, and this might sound really bad, but in the sense that as a student nurse, you're dealing with a lot anyway, so it's a lot easier to like kind of transition straight away rather than having a break and then kind of getting into the grips of it again. Fortunately, I am doing the master's part-time, and it is something that I'm really interested in. Ethics is quite a taboo subject, I want to say, because a lot of students and newly qualified nurses, and even nurses generally, often disregard ethics, but for me it's very important, especially around research. So fortunately I'm managing quite well there. Thank you.
That's great. Well, you've certainly got a lot on your plate. It's impressive that you managed to manage all of that. Thank you for giving us your thoughts. I'm going to go over to Charlotte now. Charlotte, I can bring you in, so if you can give us introduce yourself and give us your perspective on what we've talked about.
Hi, yeah, so my name's Charlotte Jakab-Hall. I am currently the Safe Care Specialist Nurse and Chief Nurse Fellow at Gloucestershire Hospitals NHS Foundation Trust. So I've been qualified just under 3 years. I'm about to go into the revalidation period. And I've had quite a really great and diverse journey so far, and I think that's an attribute to the profession itself as nursing. So I started newly qualified in my organisation, working in general medicine and endocrinology. I hadn't necessarily had any sort of placements or anything. I just was interested in doing sort of acute and medicine type work. I stayed there for a little while, but I was hungry for opportunity, as I think many newly qualified people are coming out of their degrees. And I was looking for opportunities where I could find them. So I did on the side take up other career potential in bank work, essentially. I went into criminal justice work because I thought that'd be really interesting. I wanted to know more about substance misuse because I was having a lot of that in the acute, and I wanted to sort of understand more in depth and you know, potentially in a different environment what that might look like. I did acute response in the prison service, and that was really interesting and fascinating, but quite terrifying. Not gonna lie, as a newly qualified nurse. In terms of the work, not the environment, which people often make the assumption it's the environment that seems scary, but it's not the environment at all. And then I had an opportunity come up, which was the Chief Nurse Fellowship. I saw it, I thought, that's for me. In a nutshell, it felt like I was reading my own job description that I'd written for myself. And I remember thinking, I've got to go for this. And I remember I was just under the criteria by about 3 or 4 months. And I thought, all they can say is no, so I'm going to go for this. At least it will ready me for the next time. If I don't get it, I can apply again next year, and I'll be more prepared. But I did get it, so I was thrilled. I remember being like completely out of my body situation, kind of felt surreal. I was so excited because of the potential opportunity, the development, the pure opportunity that comes with the fellowship is just great. I can't describe it in a better way than just, it's a perfect platform for opportunity. And that's because it gives you so much more exposure into different types of work, different levels of seniority. It feels as if that it's a role that really questions hierarchy, and I love that. I'm all about that. I'm all about shared decision making. Pathway to excellence is my new excitement thing that I'm obsessed with. And I think from there, that led me into another role, which was a senior staff nurse on an acute medical unit. So it was a 6-month winter secondment to try and support the area, because as we know, winter pressures, high demand is extreme, especially in acute medicine. So it was a really good opportunity to look at quality improvement, deliver some of that work I've been learning on my fellowship programme and implement that practice. So it was a really challenging time for me. I found it incredibly hard, and it really evoked the know that I had already inside me, the knowledge, the know-how that people really work hard. Nurses do not. They work incredibly hard, and it just that you mentioned ethics actually, Yasmin, and I think it's interesting because a lot of what I saw in medicine was it felt out of control, out of my control, out of my colleagues' control, and that it all came down to things like, well, ethically, this doesn't feel right. How can we make this better? What are we going to do to fix find solutions here to fix the problems that we're facing? And I think that's the important part, is knowing that those problems are always going to be there. Risk is always going to be there, but how do we mitigate? How do we improve? Like, that's what we need to always be at the forefront of our minds and our sights for our patients and workforce. And that time there led me into becoming not a shouty person, but somebody on the phone who very much wanted to make sure that I was advocating the safety of staff and patients very clearly. I used my union platform. I'm an RCN rep. And I also used my connections within my fellowship programme to say, really, let's look at this, let's address this. And that led me into my new position as a safe care nurse for Gloucester Hospitals. So now I'm ultimately responsible for 4 divisions across 2 sites. I look at acuity and staffing, and I make sure that safety issues are mitigated as soon as possible. And it's a real opportunity to have insight into the diversity of a profession just within one area, just within one hospital. Like, it's absolutely mind-blowing. And I think a lot of that is coming to my mind. A lot of this talk I see on social media in regards to people being, burnt out. We talked about the hardest year we faced, in health. It's a significant amount of time, and actually, many of us throughout long careers, short careers, have never seen anything like this. It's unprecedented. We know that. And actually that toll it takes on people is significant. So it's really interesting to see that people are now saying things like, I don't know if I can work in the NHS anymore. I don't know if I can go back here. But actually, I would, really encourage those people to look at the roles, because the diversity in roles is so significant. And essentially, I think, people could argue I've progressed quite quickly because I'm still quite newly qualified as such, but I think it's a personal perception, and I think it's really important to look at these intimate details of progression, because I don't think nursing is linear, and I don't think progression is linear. You can take 2 steps forward, but taking 2 steps back isn't necessarily not progressing. It's about what's right for you. It's about what you want to achieve in your career, and I think it's really important that we empower colleagues and nurses to look at their pathway, what they're interested in, how they want to continue their career development. And I think it's really important, because it isn't just about experience in literal sense post-registration. It's about how do we offer the skills that we have in the sphere of influence we have on our journey, because everybody's on a different one. Really interestingly enough, we talk about patients, the whole perception of no decision about me without me. Holistic care. We use those phrases all the time for patients, and rightly so, but we don't use them for the workforce. We don't use them for each other. Why are we not applying that to ourselves? My pathway will be very different to Yasmin's, will be different to anybody else, and that's how it should be. It's personalized. It's it's holistic for me, and actually we should be supporting others to go on a journey and find the right pathway for them, because in nursing it's so wide, so diverse. There is something for everybody, I've got to say.
Thank you, Charlotte. That's really interesting. There's loads of different themes, I think, and interesting points to pick out of what you've given us there. And I'd encourage everyone to think up some questions that they can ask about your experiences and how they can maybe get those applied in their organisations as well. So thank you. We've had 2 more junior nurses there then talking about their experiences and what they've done since they qualified. I'm going to come to you now, Kathryn, if that's okay. If you can talk a little bit about your perspective from your organisation. I know you have a Chief Nurse Fellows programme as well. So if you could introduce yourselves and talk us through your perspective on these issues, please.
Of course. Good afternoon. My name is Kathryn Halford, and I'm the Chief Nurse and Deputy Chief Executive at Barking, Havering and Redbridge Trust. But I actually spent 14 years of my career at Gloucester Hospital. I worked on the paediatric unit, and I started as a staff nurse, and I ended up being, it wasn't called a matron in those days, but I was a matron. And interestingly, the reason I stayed there so long was because I had my 3 children. So I started off full-time, then I moved to part-time, and I actually job shared the ward sister post and the matron's post because I didn't want to work full-time when my children were little. So actually, Charlotte saying the career that you have needs to be your career is right, and I think it's right for you and it's right for your family. So for me, that was absolutely fine, and it hasn't stopped me getting effectively to the top of the tree in terms of being a chief nurse. So I think it is important to do the things that you want to do at the time that you want to do them and not worry about where you might get to, because actually I never had an aspiration to be a chief nurse. I just wanted to be a nurse, and I still just like being a nurse. And I think it's really lovely. You can do all sorts of things. So during my career, you know, I've advised the government. I spent a year at the Department of Health advising on child health. So like Yasmin, most of my clinical practice was in child health. So I was one of the deputy chief nurses at Great Ormond Street for a while. So absolutely recognise the opportunities that there are within children's nursing, although you do get quite pigeonholed actually. People didn't think I could be a chief nurse in an acute hospital because my experience was paediatrics, but I've now been a chief nurse in 2 organisations, and a number of other organisations would quite like me to go and be their chief nurse as well. So I don't think it does stop you, but there are all sorts of barriers in nursing, I think, as you go along really. So you're just starting your career, and I'm obviously coming to the end of my career because I've done nearly 40 years in nursing, and I've always wanted to be a nurse. I wanted to be a nurse from when I was very little, and I've really enjoyed it. Some bits of it have been difficult, but I've always enjoyed it, and I've always learned as I've gone along really. And I've got some absolutely great friends. I've got lots of friends actually who still work at Gloucester Hospital on the paediatric unit who I go out for dinner with. In fact, we were WhatsApping just earlier on today. So I think you make really good friends that you keep for life really in nursing. The people that I trained with, I trained in Bath. Some of them live in Australia, and I'm still in contact with those now. So I think it's a great career because of all the things that you've talked about. There are so many opportunities, but it is so different from when I started. There weren't computers, for example. Now, can you imagine having to operate without a computer? You know, so that's been mind-blowing for people like me, because during your career, you know, I wouldn't have known what a mouse was. Well, I did know what a mouse was because we had them on the walls, on the floor, creeping about in the skirting boards, but they certainly weren't things that you operated to get your results or anything. So it was all hugely different. So I think it is really, really different now. And I think your careers will be as different as my career. I'm sure we won't know particularly what your career is going to be like, but I'm sure as a result of this environment, the COVID, we will do far more remotely. You know, 6 months ago, we wouldn't have done this, would we? We'd all been on trains going to a venue to sit next to each other on a platform. So I think life will be very different for you. And I think patients will be very different, actually. And certainly the patients that I looked after were much, much younger. So I didn't look after 80-year-old patients because they'd all died. And that's the reality of the situation. You know, I can remember the first person the whole hospital knew when we had somebody who was 100 in because it was so extraordinary. Well, certainly in my hospital, we have, you know, 10 to 1500-year-olds every single day. So nearly everybody's 80. You're struggling to find somebody who's not 80, actually. So I think it's going to be really different for you. But I really hope that you enjoy your career in the way that I've enjoyed my career. So I think one of my responsibilities is to make sure that people starting off in their career don't flounder in those first few years, because I think it's really difficult. You know, it's very stressful. And I was laughing with the finance director the other day, because when I did night duty, when I was starting out, you know, we used to put the patients to bed effectively. Then we sat in a circle at the we sat in a circle, having put the patients to bed, and did our knitting. Now, can you imagine sitting down and knitting overnight duty? I mean, it's just so different. But anyway, having said all of that, so I had, you know, a night duty for me was not a night duty like your experience. So I think my responsibility and my role is to make sure that you move into your careers going forward. So I have a preceptorship programme, and we have quite an unusual preceptorship programme where I have some sort of much older nurses, so nurses about my sort of age who perhaps don't want to be in the clinical environment anymore because they find the shifts quite hard going. They spend all of their time supporting our newly qualified nurses out on the wards, and we have nurses, we have overseas nurses and UK trained nurses as well, and that's been fantastic. So we used to recruit about 60 nurses a year. I've got about 2,500 registered nurses. Arlene will know I work in a very very difficult area in a very deprived part of London, and we struggled to recruit staff. So 4 years ago, I joined the Trust 5 years ago. 4 years ago, we used to recruit 60 people a year. We now recruit about just over 200. When I started, we used to lose 25% of those nurses. We now lose 3% of those nurses. And that's because we put a lot of effort into those nurses. We really man mark them because they're very precious to us, and we make sure that they're happy. If they're not happy, we move them to somewhere else. And that's how we've managed to keep those staff. So that's really important. We have a formal preceptorship programme in the way that you're describing, but we've developed ours to be a master's programme. So if people want to continue to do their modules during their preceptorship programme at master's level, so they can do that. So you're not trying to do your preceptorship and your master's at the same time. So we're just launching that at the moment. So we think that that's really helpful. So I really value the younger nurses in the organisation. We have a chief nurse fellowship fellows programme, which is very different to yours actually. So every week I have 2 people who spend the week with me and my team, and they just follow us round all week, and it's brilliant because they start the week by saying, yes, we've come to see what happens in the ivory tower, and all you do is sit there and send out emails. And by Wednesday they say, I've never seen anybody work so hard. There's such a lot of work that goes on up here, isn't there? It's so diverse. So all of the quality stuff, the governance stuff, complaints, how we manage safety. And you talked about safe care. We have a workforce hub where we manage the safe care. We expect our nurses to input their acuity 3 times a day because that's how we manage it. It's all electronic. They input it, we then move the nurses around based on that acuity. So that's really different. So I think that nursing is a great career. I feel very privileged to have been a nurse for a very long time. I've been to all sorts of places that I'd have never been if I hadn't been a nurse. I spent a night as the only female in a monastery, for example. I just hope that people continue to really love being nurses because we have such an impact on our patients. It's really, really important. So I hope that's helpful.
Thank you very much, Kathryn. Yeah, that's very interesting. I'm not sure the tips about knitting will go down too well if that's what you're suggesting, but no, really interesting. And I think the point about flexible working actually is something that I think we want to bring this discussion back to a little bit later on. I think it'll be a really interesting perspective on whether the view of flexible working is shared the same amongst you two as senior nurses as it is with Yasmin and Charlotte. So, but if I could bring in Arlene now, if that's okay. Arlene, thank you for waiting. If you could give us your thoughts.
Thank you very much. So I was listening with great interest to Yasmin and Charlotte's perspective and of their being students and newly qualified nurses, and I was reflecting on my own training. So I didn't train in this country. So I trained in Trinidad more than nearly 30 years ago. And there was a debate even when I was starting around what constitutes a nursing student and what constitutes a student nurse. And we worked out that we were student nurses because we only worked Monday to Friday, 8 to 4. Can you imagine? As a student for 3 years. Consequently, when we got to the final year, we had to do a week of lates. As maybe not some of you won't know what a late shift is, but you know, it was one that was kind of in the middle of the day, and then we had to do a week of nights. And for the 3 years that I was training, I realized I had never thought of what happened to patients in the evening and at night. And now I was faced with having to do those shifts. And so our late shift was 2 to 10, and I just about managed that. But the night shift was 10 p.m. to 6 a.m. and I had never worked a night shift before. And so the first 2 nights, but we were student nurses, so we all got to go away and take a break. You know, we went over to nurses' accommodation for our break. And the first 2 nights, I struggled, but I got back. And then the 3rd night, my colleagues came, they knocked the door down, they did everything. I couldn't wake up. So it was a very, very different experience for me as a new a trainee nurse, and then I migrated here, and my intention when coming here was that I was going to be a midwife, and that is on the back of a really fabulous experience that I had. So I had my 2nd child, a normal pregnancy, but at the end I had some complications, and I was looked after by the most fantastic midwife that I think anybody had ever seen. And she really inspired me. So I wanted to become a nurse. a midwife. And in Trinidad, you did one or the other. You did your RN before you could go into midwifery. And so when I came here, I was intent on being a midwife. But the first ward I went to was a elderly care ward. Well, it was a gastroenterology ward, actually. But I was fascinated by how different older people were treated in this country, and was led to, I decided, wow, you know, this midwife did this for me, but I feel like I could do this for older people, you know, and give them a very, very different experience. And therefore I started again. So, because, you know, even though I was a registered nurse, registered with the UKCC as it was all those years ago, my qualifications wouldn't be accepted by the university, so I had to start over. And I chose to start over in elderly care. So I did a diploma, postgraduate diploma, as it were, and then a BSc, and then a master's in older people's care, or anything around older people, with a vision to be in the best that I could deliver for these patients, and have really, really, really enjoyed it. But my passion around supporting students and new nurses is about the fact that my experience was very different. So I know that if I give these youngsters coming up behind a very, very different experience, the outcome could be as good as I have been able to achieve. So that's my starting point. And you know, as a chief nurse, I haven't yet had the experiences that Kathryn has. So I'm starting new on my journey as a chief nurse, and I have started already looking at how we develop our preceptorship program. So I'm going to be going to Kathryn and finding all about your Chief Nurse Fellowship in Gloucester, because I absolutely believe that if we take care of our young nurses, that we, you know, these are these people that we're looking after me. So from a selfish perspective, I suppose, if I get it right, then I will have, you know, really competent, committed nurses that will look after me and my children and their children. Interestingly, I've never managed to convince my own children that they should go into nursing, and that, you know, you kind of think, I was listening to others talk, and I think they think that I work really, really hard, and they're not sure that that's what they want to do. One of them is just now thinking about it, so I might have got there. 1 out of 4 is not too bad. So in terms of kind of reverse mentoring, I really, really like supporting junior nurses, as I say, for all of the reasons that I've said. My own experience has been as well, you know, when you need support, you really need support, and sometimes it's difficult to find somebody that is going to be able to do that for you. And my kind of mantra is I want to be that person. So consequently, you know, I will get my phone number is everywhere, all over the hospital, and I will get calls, anything from, you know, my daughter's not feeling very well, what do you think I should do? To anything in between. So, but I think it's really, really important. And as the chief nurse, I set the tone for the organisation in terms of how we support our junior staff. I remember when I trained in Trinidad, one of my lead tutors once said, he said, nursing is the only profession that eats its young. And unfortunately, that has been my experience at times. And as I say, it's all of these things that have made me feel really committed to ensuring that in an organisation that I am a part of, that is not going to be the experience of our upcoming nurses. I am currently rebuilding
Arlene,
our non-medical education team
just about call time,
to ensure that we have the structure to support new nurses and to encourage the new ones coming in. You know, even if people are coming in for work experience, that they have the experience that will ensure that they want to come back and they want to be part of this fabulous profession, where we can do everything from, you know, bring a baby into the world to give somebody the absolute best experience when they're dying, and ensure that the memories that their family have that will live on with the family are the best that they could of that experience. So that is kind of my history and what I am committed to as a BAME member and as a BAME chief nurse, and I am a rare breed. There are only a few of us. I think it has been, I feel, incumbent on me to ensure that I represent and I get the voice of BAME staff to the board as the exec lead for EDI. I think COVID taught us some really, really interesting things. But I think for me, it kind of taught me how easy it is to forget. Even if you have the lived experience, you can forget. So in my organization, we were trying to get staff to do their risk assessments because that was, we need to know. There's all sorts of reasons. And then when we had the issues coming up about BAME staff, we were wanting staff to do their risk assessments, and there was a lot of kind of reticence, or in some cases BAME staff were saying absolutely not, and I got the network together, and I said, what's going on? How can we do something about this? And I had even forgotten, Caribbean person, been living here for more than 30 years, that actually there is this bit about BAME staff that you will hear people say, we don't like to share our business with people. And what we discovered was that quite a number of staff were reluctant to share information that they hadn't shared with their line managers because it wasn't their business. And actually, these people needed support. So what we did is that we got a lot of BAME staff trained as risk assessors, so that these staff didn't have to go to their line managers to talk about what their concerns were or their underlying conditions. And our risk assessment rates just shot up because people felt safe. And I think for me as a BAME chief nurse, as a chief nurse, supporting youngsters, supporting staff in the organization is really, really important to make staff feel safe, cared for, and happy, because if they are, then they deliver good care. So I really that would be kind of my encouragement as you grow and you in your journey as junior nursing staff and you go up. Remember to look back and take people with you, but do all that you can do to get your staff, encourage your staff, and to keep them safe. If they feel safe and happy, you get good patient outcomes.
Thank you, Arlene. It's very interesting.
Thank you.
And it was interesting to hear both the positives and negatives, I think, of how it can be when you're treated when you first come into a new job, but also that great experience you had with that midwife that convinced you to do things, all the things you've gone on to do in your career. So thank you all for your contributions. I think we've got a little bit of time left to take some questions. So I think we'll wrap up this part of the discussion here to make sure that we've got a chance for live questions to come in for you, if that's okay. Great. Hello. So are we live? Yep. Hi, everybody. Thanks for joining us this afternoon. So hopefully you enjoyed the discussion that we've had with our excellent panel so far already. I'm really glad to welcome them back now for a live session where we're going to take some questions from our audience and continue to discuss the issue of reverse mentorship and what the next generation want from their work and their workplaces. I'm going to take chair's prerogative though and ask the first question. So before we have any questions from our audience, I'm going to put this one to everyone on the panel, and maybe Yasmin and Charlotte can think about it first of all, and then Arlene and Kathryn afterwards. But expectations of work are continuing to change. The NHS People's Plan sets out a commitment that flexible working is really going to become the new norm across the health service, and obviously that's something we're going to have to adapt to. How do you feel as new nurses, Yasmin and Charlotte, about doing long hours, about shift work, about flexible working? And then maybe Arlene and Kathryn can tell us a bit about how you think you can facilitate that in your organisations. So who'd like to begin? Charlotte? Yasmin? Yep, Yasmin, go ahead.
Throughout our as a student nurse, we're often required to do longer shifts and shorter shifts. And obviously this is a concern for people who have got like parental responsibilities, especially because like 9 to 5 really suits those people for like going to like taking the for example. For me personally, I prefer like the longer shifts just because I have quite a few other commitments in terms of my studies, in terms of all the other things I do. So for me personally, the long days would work fine. However, I know for quite a few other people that can be quite a hassle. And we all like work different ways and we all have our own preferences. And I think it's really important to acknowledge our own preferences. Say if people want to work more nights, or say if people want to work more weekdays and weekends. In terms of like flexible working, again, that it does provide a sense of flexibility to some people, and I feel like if done right is a really good thing. So yeah, that's my thoughts on that. Thank you.
Thank you. Do you agree, Charlotte? Is there anything you'd like to add?
I think it's interesting because you said about as we move into the new normal, which I think actually, well, flexible working in terms of especially long hours, working hard long hours, well, that's old normal. That's nursing. We know what that is. But actually, I think the most important part about this is recognizing that need, but also recognizing the needs of the people doing those hours. So what is it that's going to matter to them in terms of their health? What is it that's going to matter in terms of, as Yasmin mentioned already, flexibility with parenting, actually being able to come to work, you know, and reasonably get the work done within timeframes that actually fit, so we have a balance of some kind. And actually, really importantly, talking about potential well-being issues there, because the demand will be high, but we're used to high demand. It's about looking at what people need within that parameter. I think is really essential, especially right now.
Yeah, that's all very important, and obviously balancing things like educational wishes to go on and do more professional development, like Yasmin as well. So, Kathryn, do you want to come in on how you think you can support flexible working in your organisation?
I'm a real advocate for flexible work. Work flexibly for most of my career, actually. So I obviously started off working 5 shifts because that's what you used to work, and then moved to 3 long shifts. But probably for a good 20-25 years of my career, I worked part-time in some form or another. So I either did condensed hours or I job shared quite a lot. I job shared a matron's post and I job shared a ward manager's post, which was extremely unusual in those days because it was a long time ago. So I think that the thing that's really important is to see how you can meet the needs of the service and meet the needs of the individual, really. And you just need to be flexible about that. So it might be that you can't do long days or you can't do short days, but how can you do that by job sharing, as an example, or how can you do that by looking at whether people can work more in term time and outside of term time, so looking at term time contracts, looking at annualised hours, is that better for some people? So really looking at all the opportunities that are available before you say, no, you have to do long days or short days. I do have a personal concern actually, about people always being on night duty, because there are not as many educational opportunities available on night duty. So when I've had people who want to work predominantly nights, I've always said you need to do a month of days during the year, but you can choose which weeks you do those days so that you have the opportunity to refresh people.
It's really interesting. So flexibility on behalf of the staff, but also obviously the employer to facilitate that for people. Yeah. And to be clear, when we talk about flexibility at work, we're not just talking about providing yoga classes or anything like that.
No.
Arlene, would you like to come in on that?
No, absolutely. You know, like Kathryn, I absolutely support flexible working. I myself have never worked flexibly, but I've just been, well, I say that, but I did for a number of years night duty only. But like Kathryn has suggested, I did do a combination of days as well in there so that I could get access to the learning opportunities. So I think for me as an organisation, it is very much something that we promote. And I know we're talking about reverse mentoring. In this instance, it's about kind of our young nurses coming up. But I think we also need to remember that we have an aging nursing workforce. And therefore, you know, a 12-hour shift when you're 17 or 18 is very different to a 12-hour shift when you're hitting 60, like some of us are. So I think I'm bearing that in mind. I think we very much advocate for nurses to be able to do flexible working around the needs of the service. And it might well be that we're not able to offer it in the area that the person currently works, but if we're able to support it somewhere else, then we can do that. So absolutely, it's definitely bearing in mind the needs of the service. But if we keep people, you know, if we allow people to do what they are able to do, then they will give of their best. So it's far better to have somebody who says, look, I can do 9 to 2, but when I'm there between 9 and 2, I will give 100%, than to say, no, you have to start at 8 and finish at 4, because between 8 and 9, they're not going to focus, and after 2, you've lost them. So you've lost those hours anyway. So I think it is about ensuring that we are flexible, but bearing in mind the needs of the individuals as well, and the service.
Thank you. I mean, we ran a safe staffing forum for UNISON members earlier this year, and I was surprised at how much the issue of flexible working came out, actually. And a lot of people thought that was a real barrier to being able to staff their services safely, actually, because people were given that option. It was either, you know, our way or the highway, basically, which wasn't suitable for them. I'm going to switch the topic now. I haven't had any questions given to me from the audience yet, so I'm going to just keep going with my own questions. Yasmin, I'm going to come to you with a question. This is a very different topic, but I know I read an article that you've written about the issue of racism in the health service. To ask you, do you think there's enough done to help people from different ethnicities in terms of beginning their career in nursing, and does there need to be anything more tailored to them or done differently?
Thank you for that question. So it was interesting about that article, because initially I wasn't actually going to write that. I was going to write something completely different. It was kind of like a last minute article, and I don't think it's my most eloquent work. However, due to circumstances, I felt like it was really important. And one of the reasons why I felt it was important, because other than one article that was talking about the current issues, I really couldn't find that much on the current debate. And I feel like it was important to acknowledge that racism does exist in the NHS, sadly, and a lot of people don't really acknowledge it. As my role as a healthcare and a student nurse, and now a newly qualified nurse, I do experience now, again, what I'll say as a casual racism, and that's basically when people, they make jokingly but not intentionally are racist, and a lot of the times you kind of just let it slide and say, oh, it's fine, just mainly because of ignorance or anything. But at the same time, I felt like it was really important to acknowledge. So to answer your question, I feel like more could be done. We are doing a lot now, such as the BAME support groups, and now all the new opportunities for BAME leaders to form. However, another important thing I would like to mention is in my cohort, and I would like to mention that leads is very diverse. There was only like, 5–10% of us that are BAME, and the rest of us are like middle class white females, and I feel like that's very disproportionate, and I feel like male nurses need to be more recognised, BAME nurses need to be more recognised, so I feel like quite a bit more could be done. Thank you.
Interesting, thank you. I know it's a difficult subject to cover sometimes, so it's good to talk about it. Arlene, from obviously being further on in your career and hearing what Yasmin's saying about the issues she sees from her perspective as a newly qualified nurse, do you have anything to add on that?
Yeah, I think, you know, it's quite an emotive topic sometimes, and I think, you know, if I'm asked, have you ever experienced racism? I think, yeah, you know, you do, but I suppose as part of the profession that we are, we're able to kind of look through it, but at times you just have to stand up and call it out for what it is. And, you know, personally for us as an organization, we have taken the bold step to declare that we will be anti-racist, which I think is quite bold in that we're going to actively do something about it, and that means we do call it out. If you see it, and you know, it might be people glibly say, so, you know, I've had people say, you know, where are you going home to tonight? And, you know, I'll have a red wine and I'll have a what? And what will you have, Arlene? A rum and coke. And, you know, and I thought, well, you know, that's, and you could look at it like, oh, well, you know, that, but what does that say about what you think? You know, why can't I have a glass of red wine? And I think it's about how we, at those points in time, say to people, well, actually, you know, I can have a glass of red wine, and not all Black people drink rum and coke. And sometimes people take offense to that because they've never thought of it like that. So there is that point where you have to, sometimes you just let it slide, and then sometimes you have to say, no, you know, I'm gonna give you the opportunity to see how it feels to receive it from the other end, and that's how we're gonna go. And I think, yes, there is always more that can be done, and it depends on us in senior positions to be able to support our junior nurses that are coming through to ensure that their voices are heard in all the different fora that we have available, and to proactively support our BAME nurses, and you know, nurses with other protected characteristics. But yes, there is a lot more to be done.
Excellent, thank you. Yeah, very positive to hear that you take that kind of active anti-racist stance, and it's not just an issue that it's left to individuals and members of staff to have to deal with, which is good. Gwyn, I don't know if you have any questions come in just yet, or whether I should just keep going. If I don't hear, I'll just continue. I was going to come to Charlotte with a question then, and then possibly Kathryn. You can come and answer this as well. Charlotte, I know you're someone who does a lot of blog writing, social media. You're very active, speaking up from your perspective as a new nurse, and I think when you were a student as well. Do you think organisations do enough to help proactive nurses speak up and have a voice and influence things and their working conditions? And if not, what more can organisations do you feel?
I think that's a really good question, actually. I don't think there's ever a clear-cut answer to that specific question, however, because for me, I had a mix, and I continue to have a mix, and I have always had a mix of situations that come from my active advocation, and that's been through all, you know, walks my organisations where I've worked, my unions that I've worked for. It's always been different responses and different mechanisms there in place. So I would argue that mostly it's supportive, and that's a great thing. But there's always going to be that small backlash of, when you put yourself out there, you are putting yourself out there to risk of being responded to in a way you don't want. And I think you just need to have a self-awareness that if you're willing to put yourself out there, you should sort of expect that at some point someone's going to disagree with you and you might not like it. But it's just about being open-minded to that. To me, the most important part of advocation is that you're standing for something. If you're not going to stand for something, then what are you willing to fall for? You know, that's the question. And actually, the bigger part of it is I speak my authentic truth because that's what I feel is right for me. And I think people should always do what feels right for them. And I, you know, when I first started doing a lot of media and writing, and often I'd come across people saying, well, I just can't do that. Nobody wants to hear what I have to say. Nobody wants to hear what I have to say, but I'm still going to say it. And the difference is why I'm doing that. Well, I'm doing it because I feel like if I challenge or question something, maybe something will be looked at, even if that is then fobbed off, you know, oh, we don't care about this issue specifically, or what you're saying is rubbish, it's just your opinion. It doesn't matter. I've put the question out there, and actually putting a question out there fuels discussion, fuels debate. And for me, like, if in terms of following and Twitter and Instagram, anything like this, TikTok, I would always recommend you follow people that you don't agree with, because it really opens your mind, it broadens your perspective, it gives you more insight into discussion. It's good to have cheerleaders around you because they support you, but it's also good to have an understanding that not everything you're thinking is just one way, because that's not what the world's like. So it's really good to open that up and expose yourself to that platform. Another top tip, if people ask you to respond to something and you don't want to, you don't have to. You don't have to respond. You haven't got an obligation. You can choose to not respond, and that's as simple as it. Just leave it there.
I think that's really interesting here, because I do think there still is a perception in nursing often, and it's reinforced perhaps in some environments, of keep your head down, especially when you're a student or you're new, don't rock the boat. And obviously we all want to see innovation, we all want to see change, and that comes from people being brave enough, confident enough to do that. And I imagine there's a lot of people who feel too nervous to explore those, so it's good to hear about your perspective on that. Thank you. We've had a question from Sharon Crossan, which is, what can we do to ensure the ward nurse role remains an exciting place to work? So I'm going to put that on to you, Kathryn, if that's okay.
So I think being a ward nurse is an absolutely great place to be. You have constant contact with patients, with relatives every day. You have a meaningful interaction and an ability to really feel that you've made a difference. Somebody like me, it takes months for things to make a difference. But I think that as a chief nurse, I have a responsibility to firstly recognise that that's a really exciting and important role for us to have, but also to develop people. So some people will want to be a Band 5 nurse forever, and they will become really expert as a Band 5 nurse, and that is brilliant. I have a friend who started training with me nearly 40 years ago, and she has been a Band 5 nurse working 3 days a week in all of that time. And if I had something wrong with me in her particular field of expertise, I would want her to look after me. So I think it's that recognition that not everybody wants to be a chief nurse, but some people want to stay by the bedside, and that's a really great place to be. I think there's also things about giving people opportunities to develop whilst they're remaining within the ward environment. So I have a Chief Nurse Fellows programme which allows people to spend a week with me in my team. So they want to stay in their ward area, but they want to know where the IR1s go, where the complaints go, how we deal with safeguarding. And by spending a week with my team, we give them that exposure and that experience. So it's about how you give people opportunities within that environment. So it's fine. And I often say to people, it's fine to stay as band 6 if that's what you want to be. It's fine to be a band 5. It's fine to be a band 7. If you're all to be the chief nurse, it's going to be very crowded in my office, isn't it? So, you know, it's recognising everybody has a part to play, really, but giving people the opportunities that they want, I think, is the really important thing. So if you're a band 2 and you want to be a registered nurse, I believe it's my responsibility to make sure that's appropriate in order for you to progress into that, so that you don't feel stifled into staying in your post, that there are other opportunities. And if you want to move across the organisation, if you want to move out on secondment to gain some experience, that you're supported in doing that. I think there are lots of opportunities for people, but fundamentally, I love my time on the wards. I really enjoy it when I go and bed bath a patient and have an opportunity to talk to them. It's really nice. It's not my everyday job, but I still really enjoy it, and I love being with the patients, and I think it's a huge privilege, and people shouldn't forget that it is a real privilege to be a nurse and to be with people.
That's excellent. Yeah, I think that's really important to recognise, particularly at the moment with all the pressures there are on people, that ward nursing can be really exciting and interesting. But also, I think with all the proliferation of different roles, specialist roles, that something remains there to really develop people that are on the ward as well. So that's a very good answer. Thank you. I'm going to go to a question that came in from Paul Hardy, which was, do trusts really support staff if there's still nowhere to go for breaks and things? So I think it's getting towards about talking about the pressures on staff, and are we actually seeing the right amount of support from trusts? Charlotte, I think you wanted to come in and answer that one.
Yes, I think it's a really good question, especially in this current situation, because everything is so different now, and obviously the rules around how we take our breaks is very different, and that obviously needs to be considered. We can't create space out of nothing, unfortunately, but it's about how we look at innovative ideas to get around that and support people. And what I think is a silver lining actually from the pandemic is that people recognise now more than ever how important a break is, because they need that moment to get out of that PPE. They need that moment to get back into just a 5-minute calm of having a drink and rehydrating and taking a minute for their well-being. And that is so essential. And I think trusts have really, I feel like the conversation is only just getting started, really, in terms of how we can improve staff breaks, what trusts and organisations are doing at looking to improve that delivery. And I think as well, it's important that staff know that they should be part of that discussion and that process in making decisions about how breaks can be improved. So my recommendation would be that, you know, people put themselves out there to have that conversation about how they could make it better for the environments they work in, because it will be different depending on where you work as well.
Yeah, it's a very good point, that it's maybe made us focus even more than normal on how we need to recover and how we need to help people take that break. I was working in ICU back earlier in the year, and obviously you had to forcing yourself to come out of the PPE. It takes about 5 minutes anyway, and then by the time you get back into it, your whole break could be gone. So there's a lot more planning and really being careful about making sure you had time to switch off. And obviously, the more people are fatigued, the more likely they are to make mistakes and things which can be difficult as well. So very important. Thank you. So we've had a really good discussion, and hopefully the audience has enjoyed this. Thanks to everyone. But I'm going to finish with one question that's coming from Gemma Mitchell, which is, has enough done been to support nursing leaders during the pandemic? And how has the experience been different for managers or nurse directors compared with those on the front line, which I'm not sure I always agree with the term the front line, but those actually out there delivering care. So maybe briefly, just from all of you, it might be interesting to hear from your different perspectives on that. Arlene, hopefully it's not just red wine that helps get you through the pandemic. No. Maybe we could start with you.
Yeah, so I think it's interesting in this whole thing of front line, as you say, Stuart, because so people, you know, staff working on the ground have a different experience anyway than us as nursing directors. We spent a lot of time in the background, particularly in the early stages, just ensuring that staff had the PPE to use, you know, and we would be there till late at night chasing down the last, you know, box of 100 gowns or whatever it was that was needed, going into hardwares and buying stuff, and just to ensure that staff had the correct PPE, particularly when the guidance, as somebody said earlier, kept changing. So it was a very different experience. But you know, if you want to think about stress levels or about, you know, kind of feeling satisfied at the end of the day, which is why we all come to work, was no different to somebody. But I accept that that wasn't always visible, you know. So some staff working at the bedside didn't see what I was doing as a chief nurse, but it didn't make what I was doing any less important, I realized, because we never ran out of PPE. But that wasn't because of good luck. That was because we spent a lot of time ensuring that staff, and that's just one of the little things. So I think it has been a very different experience. It's molded and it's made some of us, you know, and teams have come together in different ways. But I think because the experience is different doesn't make it better or worse, is what I would say.
Yeah, very important point that it's everyone contributing to the response, and very different effects on everyone who's been involved. Kathryn, do you want to answer that as well?
So I think it depends what you mean by leader, really. So every week I meet with my senior leaders, so band 7 upwards, I meet with the 7s to 8s, 8s to 9s and 9s every week, an hour each. And I maintained that throughout the whole of COVID, but it changed. We had to do it in the lavender garden or in the car park. One side we did it in the park, one side we did it in the lavender garden. Let's keep people updated. So I have, it's really important as a chief nurse to have regular contact with your senior leaders, not just in this pandemic, but all of the time. Because actually when we hit the pandemic, because I know I've been a chief nurse in this organisation for some time, because I know my leaders really, really well, they know me really, really well, they felt very happy to say to me, actually, this is disastrous, Kathryn, you need to come and sort this out. So I think it's really important that you don't just lead in a pandemic, you lead all of the time, actually. So I think that's really important. I think you need to be seen to listen and be seen to hear what people are saying. So people were saying to me, you know, this is really terrible, Kathryn, these staffing levels are not very good. And I would say, I absolutely hear that. We're running at 25% sickness. You know, what do we do together to make sure we run this organisation and make sure our patients are safe? So I think Arlene talked about leading in different ways, and I think that's absolutely right, but we all need to be open and transparent about what we are doing, and that's what I endeavour to do, and I'm sure Arlene does the same as a chief nurse, all of the time talking to your staff, listening to what people are saying. And I wasn't always able to say I'm going to make it all right. Sometimes I had to say I'm really sorry. We had very high levels of death because of the organisation that we work in. I'm really sorry that you are having so many deaths, but actually what you have to do is you have to go back as a leader and you've got to support your teams. And I'm supporting you and you need to go and support your teams, and we get through this together. And I think that it's really important to have those open conversations with people that are ongoing. I hope that's helpful.
Yeah, I think that's very useful, and it's amazing. I think the difference it makes when people can see their leaders being visible and authentic, and at least acknowledging that, you know, the difficulties they're under, even if you can't make it all better. So we'll give the final word to Yasmin and Charlotte, if you would like to come in with your perspective on that as well, given what you've heard from Kathryn and Arlene. Yasmin?
Yes, so throughout the pandemic, I was a third year student nurse, so I opted in to do the extended paid clinical placement, and then from there I transitioned into my newly qualified nursing role. It's been a very different experience than most other newly qualified nursing roles will get due to the fact that they weren't working in a pandemic. The support that we've got from our leaders, I cannot fault it at all. They've always been there throughout the entire time, and they've made sure that we've been okay. And I feel like, especially as a newly qualified nurse, that's really important. But even now it's more so. And to have a team that is supporting you and acknowledges that this is such a difficult time is really important. I think one thing that has changed for me is how we care for our children and families. So being a paediatric nurse, you would spend a lot of time trying to get the play team involved, getting play a part of their care. However, now it's a lot more difficult to do so due to the risk of infection prevention control. And I think that's really important because we still need to incorporate play. However, at the same time, we need to be aware of the risk that it's in. So yeah, thank you for your question.
No problem. Thank you for your answer. And Charlotte, final word?
Yeah, so I'm really thrilled to hear the responses that everybody else has given, because they've been fantastic. And I also agree with you, Stuart. I'm not a big fan of the frontline phrase, because actually in terms of, I work in the NHS, so the NHS is a really complex service, and actually what we're talking about is direct caregivers and non-direct caregivers, but ultimately we are all caregivers. That's the service we're providing. And actually, I don't think that linear leadership is the answer to anything. I think leadership is so diverse, and actually that's what makes it great. Everybody is a leader in their own right, and actually that leadership shows through all different roles of all different levels across an organisation. And it's important that people recognise that they have that voice, and that they're part of that shared decision making process. And actually the pandemic's really highlighted, because people who mostly are deemed as experts become somebody who is also asking the questions of people who are not deemed as experts, and actually that's just opened up a whole new way for us to think and deliver what we do.
Brilliant, thank you. Yeah, and as you say, I think the pandemic has shown us the amazing things that we can do, the fact that we've got leaders in all organizations who might not be thought of as traditional leaders, but who've worked in amazing teams to do really incredible things this year. So that's a really good way to wrap that up. So I hope everyone's enjoyed the discussion. Thank you for everyone who's attended and given us questions and listened in. I'd like to say huge thanks to Kathryn, to Yasmin, Arlene and Charlotte for your contributions. I hope you enjoyed the discussion as well. And I'm going to hand over, I think, now to Steve, who's going to take over from us from here.